Good evening, and welcome to the My Horse University and E-Extension Horse Quest live webcast on Stringhalt and Shivers Explained. The presenter for this evening is Dr. Stepahnie Valberg. Stepahnie is the Mary Ann McPhail Dressage Chair in Equine Sports Medicine at Michigan State University. She received her undergraduate degree in DVM from the Ontario Veterinary College and completed a PhD in equine exercise physiology at the Swedish University of Animal Science, as well as a residency in internal medicine at the University of California, Davis. Previously, Dr. Valberg was a professor and director of the University of Minnesota Equine Center in St. Paul, Minnesota. She is a board certified in large animal internal medicine and equine sports medicine and rehabilitation. Her research centers on neuromuscular diseases in horses, with a special focus on genetic diseases of skeletal muscle and their nutritional management. Please note, you are able to ask questions during the presentation via the question and answer button at the top of your screen. We will be pausing at certain times throughout the presentation to answer questions, and there will also be time at the end of the presentation for additional questions. We will also be recording this session today, and we'll be putting it up online for folks to access later. And at this time, I'd like to turn this over to Dr. Valberg.
Thank you very much for that introduction, and thank you everybody for tuning in. I'm excited to be able to talk to you about some of the work that we've done with Shivers, and to give back to all of those of you who helped us with our research. Many of these disorders are fairly rare and they're spread out across the country, and so to do research on these disorders, we really need everybody's participation. And we've had some great participation from folks that I want to thank, and want to share with you what we have found from your participation in our questionnaires and surveys and from donations of horses with Shivers. The goal of this presentation then is to try to get you the most up-to-date information on Shivers. We don't have all of the answers, obviously, at this point in time, but I think we've learned enough that we are able to help more of these horses manage this condition. So what I'd like to do today is, first of all, try to provide videos and a definition of what movement disorders are in horses, then to narrow the definition of Shivers and narrow the definition of Stringhalt and characterize them as specific movement disorders. Talk about the factors that predispose horses to Shivers that we learned from our online surveys and questionnaires, and then describe the exact abnormalities in different classifications of Shivers so you can help to identify whether or not your horse may have Shivers. Then talk about the research we've done to localize where it is in the body that the abnormality is that causes Shivers, and then to contrast that with Stringhalt and be able to provide some videos to show you the differences in the way those two conditions function. So the most common movement disorder that you're familiar with would be lameness. Everybody from time to time has a horse that limps, and usually that's from pain in the bones, tendons, ligaments, or the muscles. For example, your horse may have bone spavin, a common condition of the hock. Or the lameness may arise from the fact that the horse has got a physical restriction for movement, or fibrotic myopathy, and that's why it has a change in its stride. Horses also move abnormally because they don't know where their limbs are in space, so their sensory system isn't passing information on to the brain, and they move in a very irregular fashion. A good example of that would be a wobbler, where there's compression of the spinal cord in the neck, and that affects the information that's flowing forward from the limbs to the brain. And then the classification of diseases we want to talk about today, which are motor ataxias, or ataxia meaning abnormalities in movement, and Shivers in particular is a disorder of voluntary movement. So if you think about a young foal being born, they can get up within a few hours and they have an innate knowledge of how to walk, trot, and canter. So their gaits are very inborn, and they're very rapid and very repeatable, and they occur within microseconds. So those kinds of very complex gaits that are managed in such a quick fashion are usually arising from the spinal cord itself. So there's a pattern that's already generated in the foal. It is a pattern that takes in some information from where the limbs are from the sensors, goes directly up to the spinal cord right above that limb. Then there is a rhythmic sensor that provides information about the gait. It communicates between the flexors and the extensors and the various muscles in the limb across the various joints. And it very automatically produces a gait so that it knows where the limbs are, the front and the hind limbs. It's coordinated to produce a walk, coordinated to produce a trot, coordinated to produce a canter. So that's something that happens right at the level of the spinal cord. And lameness can affect this by causing pain in that limb, and then it will automatically affect the gait, and it will create a very regularly irregular disturbance of gait, because each time the pain is felt when the limb is on the ground, then that is going to fire off, hit the spinal cord, affect the nerves there, and give you a lameness. And a good example of that is seen here. If you watch the way this horse moves behind, it has a very regularly irregular abnormality in the way that it's moving its left hind leg. The gait is shorter, and each stride looks very much the same, although the left hind and the right hind don't move in the same fashion. And that's one of the ways that we try to detect lameness, is to look at the rhythmicity of the gait and look at the way that the limbs are moving left side versus right side to see that we've got a lameness. And in this horse's case, one of the things that's bothering it is its hocks, and so it's taking a shorter stride on the left. The left hock is much sorer than the right, and so you have this irregular disturbance of the gait pattern. This is another example of lameness, but this is an example of lameness where the movement is actually restricted. This was a horse that was tied to a trailer, and the owner happened to be away for a moment, and the horse started to pull back, and it created a tense fibrous band of connective tissue once the semimembranosus and tendinosus, or the hamstring muscles, healed. And those muscles are right where the blue arrow is pointing. And you'll notice when this horse walks that both hind legs take a shortened stride. It's almost like a goose step. Again, it's a regularly irregular gait. Both legs are affected in this case, and it takes a very short, choppy stride. The horse knows where its limbs are, but it's unable to move normally now because it's got so much scar tissue that's formed in those hamstring muscles. So this is another example of what we would call a lameness. Another form of movement disorder are these sensory ataxias. And sensory ataxias arise because the sensory information that arises from sensors that are in the muscles and the joints and the ligaments, that information passes up into the spinal cord, and then it runs forward up the spinal cord to the brain. And the brain then quickly processes that information and uses that information to influence a movement pattern. And if that information isn't properly flowing up to the brain, then the horse is going to have kind of a herky-jerky, very irregular movement. And wobblers, as I mentioned, was a good example of this. And another example of this is this disorder called NAD, which affects degeneration of the sensory nerves. If you watch the right hind, it swings wide. The horse is looking a little wobbly, a little bit like it's drunk. And the movements are very irregularly irregular. So you can't predict when it's going to take an abnormal step, but that's what makes it kind of herky-jerky in its motion. And that's a result of the sensory system not being able to process quickly information about where the limbs are in space. And so the animal takes these irregular steps depending on what kind of sensory information is being passed along. So the kind of movement disorder I want to talk about today is going to be a motor ataxia. So this is a disorder not in the processing of the sensory information, but a disorder that arises when you've got voluntary movement that has to be planned by the brain, and then that information has to be transmitted down the spinal cord and then to the motor nerves that are going to control the flexor and the extensor muscles. And voluntary movement disorders can be highly unpredictable and sometimes only occur when they're stimulated by certain types of sensations or certain types of movements. So it's a disruption of the plan for movement that's occurring. And it can occur because of abnormalities anywhere from the brain down the spinal cord to the muscles. So if you watch the left hind limb of this horse, it's walking fairly normally here. Now it's planning to make a turn, and all of a sudden you have a very abnormal movement in the left hind leg with that turn. There isn't any pain that's causing this horse to be abnormal. If you do a neurologic evaluation, you can find that this horse knows where his limbs are in space, but there are certain types of movement that induce an abnormality in the way the horse moves, and that's what makes this a motor ataxia. There's a planned movement, and during that planned movement, we see an abnormality in the way the muscles are contracting and the way the limbs are moving. So this is an example of a horse that has shivers. So movement requires sensory information be processed up in the brain. Then the cerebrum, the thinking part of your brain, has to make a plan for what kind of movement it wants. The cerebellum, also called the little brain, will give information about exactly how that pattern of movement should occur, and then the plan travels down the spinal cord and it communicates rapidly with all of the extensor and flexor muscles across all of the joints, and it gives you that very planned movement. It's almost like your muscle memory is coming from that planned movement pattern. So how do you know if your horse has a movement disorder? Where there isn't one specific test that we can do where we can take a blood sample and we can say, yes, this is a movement disorder. What we want to do is to go through all of those three types of movement disorders and decide whether we can rule them out or not. So normally what we start with is an evaluation of the horse moving, decide whether or not the animal looks like it has a lameness, which we called regularly irregular movement. So we're looking for evidence of pain that we can localize or restriction of movement. Then we would do a neurologic evaluation, and we would do an exam that would allow us to determine if the horse knows where its limbs are in space and if it's coordinated. We would watch the horse in all kinds of gaits, including walk, trot, canter, backing up. And then we would characterize the pattern of movement in order to be able to come up with terms like shivers or Stringhalt or Stringy. When we first started this work, we did a long investigation of what had previously been done, and there were some terrific clinical descriptions of shivers back from the 1800s in textbooks. So when horses were the primary mode of transportation, we had a lot of draft horses, they characterized shivers as being as common as dirt. And there was a lot of knowledge from veterinarians back there about this disorder and what it looked like. After the Second World War, when we had many, many fewer draft horses, a lot of knowledge about this disease seemed to dissipate. And so what we tried to do was to go back and use the previous knowledge that had been written in the literature, use videos that had been sent to us, and try to get a better definition of exactly what the abnormal movement is so we could make a more clearer diagnosis of shivers or Stringhalt. So we asked owners to submit videos of horses, and we asked them to fill in questionnaires to describe all the various movements of horses. And in particular, we were interested in clear descriptions of how the horse looked when it walked forward, when it turned tightly, when it backed up, and what occurred when we were picking up the horse's hind limbs as well. And from looking at all of those videos and the descriptions, we came up with this classification scheme for shivers, which I think is really helpful. The first we call Standing-Hyperflexion, and I'm going to walk through what that is. But basically, when horses are just standing still and you go to pick up their hind limbs, many times a horse will hyperflex its hind limb. That's really a pretty common reaction, and then they have to relax that limb and give it to you. And many owners were very worried that their horse had shivers because the only abnormality that they would see was when they picked up the horse's hind limb, the limb would hyperflex and hold there and tremble before it relaxed. Those horses would walk forward and would walk backward normally. We did not call that shivers. Then we had three other forms that we did call shivers, and I'm going to go through videos to show you what those three forms of shivers look like. But basically, as you can see on the right, our definition of shivers had to include an abnormality and difficulty in walking backwards. And that was because we need to have a clear set of abnormalities that looks like they're involving the nervous system. And that seemed, that movement really did make that clear. So with standing hyperflexion, horses would often just hold that limb up and flex. And what we found when we had the opportunity to evaluate many of these horses is that in some cases the horses were painful. They could have pain in their feet, they could have tendinitis, they could have pain in the hocks, pain in their stifles, or sometimes it just seemed to be a mild abnormality that the horse relaxed out of, and it didn't necessarily reflect one single disease per se. So when horses had that characteristic, but they backed up normally and walked forward normally, we really felt it was important that they had a thorough lameness evaluation and that we ruled out any kind of pain that was causing them to hyperflex that limb. The other thing about horses with standing hyperflexion is if that's all they did and they didn't have any abnormalities backing up, many of these cases were very mild. They might maintain that standing posture for the rest of their lives, but it didn't necessarily progress like we'll see with the conditions that we're defining more closely as Shivers. So this is an example of a horse that has a normal response when you pick up his left hind leg. When I pick up his right hind leg, he'll flex it, and then he'll hit a point where he really hyperflexes. When I try to repeat that, it's not very repeatable, and I'm trying to find a position that seems more painful that causes him to hyperflex. So in a situation like that where it's just one limb, when you get that kind of automatic reaction, then it's really important to watch the horse move and to see if you can see a lameness. And in this horse's case, he was very lame on that right hind leg. And so we have a horse that's got standing hyperflexion, but the standing hyperflexion was a result of pain. And I wouldn't have characterized this as Shivers. In addition, this horse backs up normally. Sometimes you worry that the standing hyperflexion is an early sign of Shivers in horses. And this would be one of those kinds of cases. This horse actually could back up quite normally, but he has some of the characteristics that we sometimes see with horses with Shivers in that they develop an aversion to wanting you to pick up their hind leg, and they'll do a lot to try to avoid picking up that hind limb. And I'm going to talk a little bit about why this may be as we get into some of our later research. But when the hind limb does get picked up, you can see that there is a lot of muscle trembling and shaking and hyperflexion in this horse's case. So you certainly want to rule out lameness. You want to make sure that there isn't something painful that's affecting this horse and causing it to hyperflex. You'd want to do a neurologic evaluation, make sure it doesn't have any sensory ataxias, and then back the horse up to see whether or not it has a more classic signs of Shivers. One of the things that is fairly characteristic of Shivers, in addition to horses not liking to pick up their feet, and this is a horse that did have difficulty backing up and would characterize as Shivers, is they'll often give you the opposite limb when you go to pick up the hind leg, in addition to that degree of hyperflexion that you observed there. So there's a reluctance to want to give you the limb, and then as you can see, offering the right hind rather than the left hind limb. That's not a behavioral problem. That's part of the condition of Shivers. That's part of not being able to do what you're asking them to do, even though they'd like to be able to do that. So difficulty picking up the hind limb, hyperflexion, and offering you a different limb, and also being very reluctant and uncomfortable about picking up the hind limb are characteristics of Shivers. This is another form of Shivers that we call Shivers-Hyperextension. Rather than hyperflexing the hind limb, you can see that the hind limb gets straightened or hyperextended and put out behind, the tail goes up, and even the front limbs in this horse get hyperextended. The difficulty in evaluating horses like this is that they will become so hyperextensive you can almost not move them backwards. And in this horse's case, we backed him up twice, and then after that, we couldn't get him to back up. No matter how many strong people we had pushing on him, he got so hyperextended and stuck in the ground. And that can make it a challenge when we say that they have to have an abnormality backing because you're having difficulty getting them to back up in the first place. This is another example of hyperextension. You can see the horse walks forward normally. And when asked to back up, watch the right hind. He hyperextends that limb out behind. Not every single time, but there's still more hyperextension. And it's not unusual with horses with shivers that one side is worse than the others, and frequently it's often the right hind that seems to be a little bit worse than the left hind. So this is probably what we often see more classic. This is a very mild case in a beautiful horse, walks forward quite normally, and then has hyperflexion, again, more in the right hind than in the left hind, and it's a little bit intermittent. Sometimes the steps are normal, the horse is quite cooperative in backing up, but we do see hyperflexion, particularly in the right hind from time to time, and then a little bit of hyperflexion when we're picking up the hind limbs. So this is a fairly mild case, but you can see he also offers that opposite limb. As Shivers progresses, you will get a few steps of forward hyperflexion, and that's what you see with the left hind here with the turn. We're thinking about making an adjustment, and then the horse with that planned movement starts to show evidence of hyperflexion. And that's something that gradually seems to progress over time in some of the horses that start with difficulty backing up, that then they will have the odd step forward where they have a problem, and then you can see that there's some pronounced abnormalities backing up with hyperflexion, kind of getting stuck. So the next example is one of the rule-outs for Shivers, which is a lameness where the patella gets stuck. You see how the hock will get really straightened in the right hind? It's dragging it around, and then it has to release the patella, and to do that, it rapidly flexes the limb. And that always occurs after the limb is hyperextended, where the patella gets locked, and then it will hyperflex and release the patella. So this is not Shivers. This is upward fixation of the patella. It occurs in horses that have really straight stifles and hocks, and occurs when they're a little taller behind than they are in front, or when their quadriceps muscles get weak. So that movement can somewhat resemble Shivers, but it is a snappier movement. It comes after they've been extending that hind limb. This is a more extreme example of Shivers forward hyperflexion. This horse has a great deal of difficulty backing up. Most of his forward steps are normal, but when he turns, or when the ground changes, or when he's been standing still for a period of time, he'll have hyperflexion, and then he'll walk normally. So this horse started showing signs at the age of 3, and he's progressed here for about 15 years, slowly becoming more and more problematic from just having difficulty holding up his hind limbs when we were picking out his feet, to over time progressing to having difficulty with forward movement. So Shivers forward hyperflexion seems to be a gradual progressive neurodegeneration that's occurring following the first signs of Shivers hyperflexion. So movement disorders, particularly Shivers, the thing that's very characteristic about it is, for the most part, the horses will move forward normally, particularly at the beginning. They will have some difficulty picking up their hind limbs. They will usually, when you pick up their hind limbs, either hyperextend them so you can hardly flex them, or they will hyperflex and hold them hyperflexed for a period of time. They, by our definition, will have difficulty backing up, either hyperextending their limbs or hyperflexing. And then specific movements will cause an abnormality. But when they trot and when they canter, they trot and canter perfectly normally. Their forward rapid gaits are fine. And that occurs even when the disease has progressed. Their trotting and cantering are usually perfectly normal. And the movement disorder, as we mentioned, it's a voluntary movement, is often triggered by certain things like turning rapidly, or stepping over an object, or changes in the surface, going from a soft surface to a firm surface. And that change induces the gait abnormality. So you can see here that stepping over the rake is what induced the abnormality in the right hind, and then the abnormality seems to go away, and then it will get triggered again. The other thing that was reported to us by the owners of horses with shivers is that the horses seem to be much worse in cold weather, and they also seem to be temporarily much worse when they're under conditions of stress and excitement. This shows you again one of the horses that we studied that gradually progressed over time. And you can see that even though his slow gaits are not normal, he's still a beautiful jumper. He's still very, very aware of where his forelimbs are. And he just progressed from a one-star horse to the level of training as his Shivers condition gradually increased. So they know where their limbs are. Their sensory abilities are quite normal, but their control of slow movements and voluntary movements is affected. Well, how can that be, you would ask, that you could have a neurologic disease? Well, Shivers horses don't have Parkinson's, but this is an example of Parkinson's disease where someone is so severely affected they can't walk and they can't voluntarily move their feet forward and backwards. And yet, you take the same individual and put him on a bicycle, and he has absolutely no difficulty at all with that particular movement. It's completely freeing. So the nervous system is incredibly complex, and certain parts of it can be affected, and it can affect specific movements, and then it cannot affect other types of movements in the same individual. So I think that's part of the explanation for why Shivers horses can have such difficulty backing up, and yet they can jump fine, they can perform at a canter fine, they can do dressage fairly well as well. And you'll notice that when he gets off his bicycle, even though he's got great freedom of movement while he's cycling, he will be unable to walk as soon as he gets off the bike. Very, very perplexing. So what we found with Shivers, why do certain horses get Shivers? We were very, very excited about participation. We had 305 horses from around the world that had owners respond to our survey. Of those horses, we received 50 videos. And you can see that we classified 157 of those horses as Shivers by the definition that I just gave you. So they had to have difficulty backing up. And 27 of those horses, we had video where we felt very good about the fact that this was clearly Shivers, and we asked each of those owners to give us 50 horses in their barn or friends that had horses as our control group to compare to. And we had 67 horses which the description was really good, and we were able to classify those horses quite confidently as having Shivers as well. And then 63 horses that appeared to have the advanced form of Shivers with forward hyperflexion. The average age between our Shivers horses was about 11 years of age and about 13 years of age in our comparison group. And it was clear that one of the significant differences in horses with Shivers is that they're tall. They're usually at least 16.3 hands. They were taller than the horses in our control group. And there are more geldings that are affected with Shivers than mares. It's usually a ratio of about 3-to-1 or 5-to-1 geldings affected, which was significantly more geldings in that group than in our control group. They all had difficulty backing. That was, of course, our definition. Difficulty shoeing, as I'm sure some of the questions will show, is one of the real difficulties of owning a horse that has Shivers, because they hyperflex and then sometimes release and slam their leg down. Most of them have muscle twitching. That's why the disease is called Shivers, is because they're quivering and shivering of their muscles. At least half of the horses had evidence of the muscle mass gradually decreased with time, and some of the owners felt that their horses became weak. One of the important things that's bolded at the bottom is that at least half of the horses the owners felt gradually progressed over time. That's one of the most common questions we get is, should I buy a horse with Shivers? You know, what's the likelihood it's going to progress? And from this data, we can say that at least 60% of the horses with Shivers will progress. It can be rapid, but much more commonly, it's just a gradual change that occurs over time. So if you are going to have a horse and you're expecting it to be competing for the next couple of years without any change, you might well be able to continue at that level. But over time, most horses with Shivers will gradually have a decline in performance as they get slightly weaker, or as their Shivers progresses, or if they're expected to movements like backing up in dressage tests. The other thing that was important from the information we learned is that horses will often show signs of Shivers at around 4 to 6 years of age. They don't show it as foals, but it usually can show up as early as 2 years of age. And if it's going to show up, it's usually showed up by the time the horses are 10 years of age. And as I mentioned, it will temporarily be worse with stress. And at the bottom of some of these slides, I have provided the references for the material that was published. This is Alex Draper in the picture here, and this was her master's work. Some of you may well have interacted with her as she collected the data. We also asked everybody, what they found was most effective in treating Shivers. We had a lot of remedies that had been tried, from acupuncture to herbal supplements to chiropractic adjustments, electrical stimulation. There wasn't one thing that anybody suggested helped. There was some dietary changes that people tried. Some people felt that the lower starch, fat supplemented diets may have helped, but we didn't really have strong statistical evidence for that. We didn't have evidence that vitamin E supplementation necessarily makes horses better with Shivers, although we felt from looking at the data and following horses that it would be a bad idea for them to be deficient. And we often recommend that you test and make sure that they have adequate levels, because vitamin E is important for supporting the nervous system. So we don't think a deficiency causes the disease, but we think it's a good way to support these horses to prevent them from being deficient. The most common thing people felt helped sustain the horses was keeping them active. And there were several owners that commented that if they gave their horse time off and just let him out, that it was much more difficult to get him back to the same level, and that they felt that if they kept their horse in training to a certain extent and moving around and being active, that was the best way to slow the progression of the disease. One of the things because of that we wanted to look at is, could we improve their ability to back up with long lining? So we had a student at the University of Minnesota who worked with one of our horses that had difficulty backing up, that was donated a Belgian draft horse, and she long lined him and was able to get the horse to back up much more smoothly and regularly with regular practice. The downside of that was that he didn't like to back up, and he got progressively more and more difficult to catch, to the point where it would take an hour just to catch him to do 5 minutes worth of training backing up. So clearly, although it was beneficial for his movement, it really created enough distress that it wasn't something he wanted to participate in. So this shows you an example of the difficulties in picking up the hind limb of horses, and then the difficulties you can imagine that a farrier would have in trying to shoe one of these horses. And then the one thing that seems to make it easier to be able to pick up a hind limb is sedation. So this is an example of a horse that's had domesodon or ditomidine sedation. The sedation allows you to pick up the limb if you're strong enough, but this can be fairly difficult. So under circumstances like that, what people will often use is a sling. This is the same horse with and without sedation. So using a sling, something to rest the hoof on, can be helpful in trying to get sedation. That it can be one of the most difficult things dealing with. One of the most ingenious mechanisms I've seen, there's a YouTube video of someone who's had a horse with Shivers, and what they do is they take their horse and stand it in sand, and then they dig a hole in the front part of the foot and trim and rasp with the horse standing on the foot, but having enough sand dug out to be able to get at the front of the hoof. They fill that in, or move the horse forward, dig out the back part, rasp the back part of the foot, so the horse doesn't actually have to pick its foot up. I thought that was quite an ingenious solution. But this, besides sedation, and being very calm and very quiet and not flexing the foot higher than you need to flex it, it can be a huge challenge to be able to trim the hooves of these horses. So I'm going to talk about the basis for Shivers, but I would be happy to take some of the questions now if I'm not going to cover them in the next segment. So one of the questions that was asked is, would acylcarnitine be beneficial because of its neuroprotective effects? So I think carnitine, as I understand it, is good for mitochondrial function. It helps to transport long-chain fatty acids across the mitochondrial membrane for lipid metabolism. And I think by the time they start showing signs of Shivers, there's just nothing that seems to be able to reverse it. It's quite similar in human medicine. When you have neurodegeneration, it's very difficult to get nerves to heal. So I definitely think it's good to have a horse on a balanced diet and they have adequate amount of antioxidants in their diet, but I don't know that carnitine would be something that would be beneficial for these horses. Neurologic test is something that your veterinarian would do. We go through a lot of training and schooling in order to be able to identify subtle defects that are causes of neurologic disease and sensory ataxia. So that would be the best thing to do, is to have your veterinarian evaluate the horse with a neurologic examination. We did evaluate whether or not there was a causative link between polysaccharide storage myopathy and Shivers. We did that by going out and taking muscle biopsies from 113 Belgian draft horses. And then we evaluated those muscle biopsies to see if they had signs of polysaccharide storage myopathy. At the same time, we evaluated the horses to see if they had signs of Shivers. And what we found was that 1/3 of all of the Belgian draft horses have polysaccharide storage myopathy. It's very, very common in draft horses. And 1/3 of the Shivers horses had polysaccharide storage myopathy. So sometimes horses can have both Shivers and polysaccharide storage myopathy, but one doesn't cause the other. They're not related to each other. It's just that in draft horses, both conditions can be fairly common. One question is that the horse is now offering a forelimb instead of the opposite hind limb with Shivers, and that is possible that it can start to have milder effects on the forelimbs. There are signs described of Shivers in the front limb of horses. I personally have seen videos, but I have not looked at horses. But those horses usually will start to shake and tremble when you pick up a front limb rather than the hind limbs, and whether or not that's the same cause as the hind limb Shivers, we don't really know. And farrier appointments, they are a challenge. There are at this point in time, no really good ways to be able to do that besides keeping the limb low, keeping the horse as quiet and calm as you can. And I'm going to talk a little bit about why that's so challenging when we talk about some of our research as well. Okay, so I'm going to move on to try to explain why horses do these things. So I had a unique opportunity at the University of Minnesota to work with two neurophysiologists, Dr. Jürgen Konzak and Dr. Josh Amon, that work at the School of Kinesiology in the Human Sensory Motor Control Lab. They've done a lot of work with Parkinson's disease patients. So one of the first things that they asked me is, could this be like Parkinson's disease? And we did a study somewhat similar to if you've seen the movie Awakening with Robin Williams, where we gave the drug L-DOPA, which is used to test for Parkinson's disease, to horses with Shivers. And in Parkinson's disease, as a diagnostic test, that will make the shaking and trembling that you saw in that video go away. And when we tried that with our horses with Shivers, it had absolutely no effect. So it's not the same disease or same condition as Parkinson's disease. So after that, what we decided to do was to try to use some of the sensory motor testing to define why it is that with horses with Shivers, when you're backing them up, they develop that really strange gait abnormality. And Josh Amon, who did the neurophysiology, luckily for us, also grew up on a farm in North Dakota. So not only is he an amazing neurophysiologist, but he was able to be bold and to work with our draft horses and to try to get the study done. And it was under the direction of Dr. Konczak, and with lots of muscle contributed by Ann Nicholson. So this is what we wanted to do. We wanted to know what was going on with the muscles and nerves in the horse's hind limbs with Shivers. And what you see here are electrodes that we attached to the skin of the horses. And the electrodes are attached over specific muscle groups. And what those electrodes will detect is if there's electrical activity in the muscle. So it says, is that muscle contracting and firing and supposed to be producing force? And it will be able to tell us exactly when it's contracting and active and exactly when it's relaxed. So we picked pairs of muscles. So we would have a flexor muscle and an extensor muscle, because we know one should be active and the other should be quiet at the same time. And then the other one should be active and the opposite muscle should be quiet at the same time. So we could see if this motion was smooth and coordinated. So we picked the biceps femoris and the vastus lateralis muscles, flexors and extensors of the stifle. And we picked flexors and extensors of the hock as well. And then on the fetlock, we put a thing called a goniometer. And the goniometer was necessary to be able to tell us if the horse was standing on the limb or if it was the limb was up in the air. So it gave us an indication of where we were in terms of the stance phase of the stride or the swing phase of the stride. And this shows a tracing from a healthy horse during walk. So it's measuring the percentage of the peak amount of force. For us to measure peak force, what we did was trot the horses, and we measured the amount of force that was generated at a trot. And then this is telling you the percentage of force that's being generated relative to that maximum amount of force. And then the bottom tracing, the red tracing, is the goniometer. So when you see a peak, it's in the swing phase. When you see a valley, it's in the stance phase. And each one of those dotted lines show you one stride. And then we have a Shivers horse at the bottom during the walk. And this horse looked perfectly normal to me walking. I couldn't tell that there was necessarily a difference between the Shivers horse and the healthy horse. When you look at the timing of this, if you look at the red dot, we've got the swing phase and stance phase, swing phase, stance phase. You've got a muscle that's on, off, on, so that we've got flexors on and extensors off, extensors on and flexors off. It's perfectly well timed and precision. When we looked at a Shivers horse walking forward, even though it looked normal walking forward, this horse's muscles were firing irregularly, and some of the muscles were on when the contrasting muscle was off. So we had both flexors and extensors firing at times. Sometimes we had strong force, sometimes we had weak force. So we had a much more irregular pattern of muscle firing, even when the horses were walking forward and looking fairly normally. What we did with this then was to take all of the strides and overlap them onto one. So we took the average of each stride and put it all together. So we had the mean amount of electrical activity and the range in electrical activity over one stride. And that's what this is showing you here. We're looking at one stride. This is the goniometer showing us that they were at the end of the swing phase. The foot is on the ground during the stance phase. We're moving up into the swing phase. We have the two contrasting muscles and just a little bit of activity, the mean and the two standard deviations of activity here at the beginning of the stride on the biceps, and then it's down and quiet. The vastus lateralis, we have a little bit of activity here, and then a lot of activity towards the end of the stance phase as he picks the leg up and moves it forward. And this is the average of all of the strides in Shivers horses. We've done this now with 7 Shivers horses. This is just one. You can see the abnormalities in more muscle being recruited, so higher activities compared to the normal, both for the biceps femoris and the vastus. And then we don't have the same period of time when we're quiet and the other muscle is active. They're both being active at the same time, even in the stance phase. Well, what happens when you back them up? Well, when you back a horse up, a lot of times a normal healthy horse will shuffle backwards and they'll use a tiny little bit of muscle activity. Again, when one is on, the other one is off. Again, this is the biceps femoris and the vastus lateralis, the same muscles before. And this is what happens with Shivers horses. all of the muscles are firing all at the same time. So when you say, what can I do to help my horse with the farrier, this is why it's so difficult. The horse has no control over its muscles when it's backing up or when you're asking it to pick up its hind limb. Even though it's standing on this limb and the limb is not moving at this point in time, all of these muscles are firing. It's why it doesn't want to back up. That hurts. You can imagine the cramp that's occurring when all of that activity occurs, and the horse has no voluntary control over that, but it probably knows it's going to happen. It's a smart horse. It knows that when he picks his leg up or when he backs up, he's going to have all of that nasty electrical activity that he can't control. And when you ask for one leg, you might get that activity in a different leg. There's not the degree of control over being able to say, please don't contract any of the muscles in this leg. I'd like to be able to pick it up. So this is why horses have shivers, is they have, with certain voluntary movements, an inability to voluntarily control which muscles are contracting, which muscles are relaxing at any one given time. They can all fire off at the same time, either with strong extensors giving you Shivers-Hyperextension, or with stronger flexors giving you Shivers-Hyperflexion. So shivers is a sustained muscle contraction that's initiated by very specific voluntary movements, and the opposing muscles are contracting simultaneously, and that's giving you this movement, and it's giving you the distress and the anxiety that the horses feel because they know that an impending muscle cramp is coming. And then all of a sudden this will give way and they'll relax, and then the limb will very, very rapidly come to the ground. So the last part of our research on shivers that I wanted to talk about is work that we did to try to figure out, where is that coming from? Is that because there's an abnormality in the muscles? Is it because there's an abnormality in the motor nerves that are supplying the muscles? Is it in the spinal cord? Is it coming from the brain? Can we figure out what the basis for this is? So the first thing that we did was to have owners who had horses with shivers where it was really impacting the quality of their lives. I consider donating the horses to our research. So we've had 3 Clydesdales and 5 Belgian draft horses and 4 warm blood horses that have been donated to us over time. 1 thoroughbred that had such severe shivers that it was time for them to be euthanized because of the quality of their lives. And then once the horses were euthanized, we sampled a large number of muscle groups to see whether or not they had any evidence of muscle disease, and we didn't find any evidence of muscle disease. What this is showing you is muscle cells, and it's looking for glycogen. If the horse had polysaccharide storage myopathy, we'd see abnormal glycogen, which we didn't see. But we saw some of the muscles actually were depleted of glycogen, and this is probably because of what we showed you before, that they're turned on all the time, or very, very frequently, not all the time. And because of that, they're burning more fuel. Then once the animals were euthanized, we took out their nervous system and we evaluated that in great detail. And this was amazing work that was done by one of the neuropathologists at the University of Minnesota, Dr. Annabelle Armin, and it was published in the Journal of Veterinary Pathology and actually won an award for the best research paper last year because of the work that Dr. Armin was able to do. And this took him a couple of years in our horses to go through in horses that were the same age but had been euthanized because of lamenesses, and he looked at the spinal cord in the back area, the spinal cord in the thorax or the chest area. He looked at the brain, the area of the brain called the cerebellum, and in all of these lines represent different sections, and he went through all of that and looked for any evidence of abnormalities. And the first thing that he started to notice was that there was some damage to the parts of the nerve. They're called axons. They're the long branches of the nerve. So this is a nerve cell body, and then it delivers information and connects with the next nerve cell body at the ends of the axons here. And there's a lot of information that has to get transmitted from the end of the axon back and forth, up and down this part of the nerve cell. And if that information can't be transmitted freely back and forth, it will start to accumulate and cause swellings. And these swellings were what he could see under the microscope. And he started counting all of the swellings in all of the areas that he was looking at, both in the healthy horses and in our horses with shivers. And in many areas, we didn't see any difference between our horses with shivers. We had some mild evidence of neurodegeneration in the spinal cord, for example, in different areas. In the cerebral cortex and the motor areas, we didn't see any abnormalities. But if you look in this one little area that was probably about the size of your fingernail, we found about 80 times more swellings or evidence of nerve degeneration in this one specific area of the cerebellum. And the cerebellum plans movement. As I mentioned earlier, it's kind of the muscle memory, if you will. And he identified this because he did some very special stains that had never been done before in the horse brains that he was looking at. And this shows you a normal horse with a special stain. This is a nerve cell body. And then all of these little red dots are the ends of a nerve cell called a Purkinje cell that's in the cerebellum that's communicating all of that information to this nerve cell body that will then take the information and run it up to the cerebral cortex to help make plans and run it down to connect with nerves in the spinal cord. And this was the abnormality that he noticed, that you can see when we have the special stains, it really sticks out. We have less of these little tiny buttons that are communicating with the next nerve to tell it what to do, and some degeneration and large swellings where you would have very little information being transmitted up and down that particular cell in the cerebellum, the Purkinje cell, because of these big swellings and degenerations in the nerve. So this is the first time we had any indication of where in the nervous system shivers might be originating from, and we believe it's originating from this part of the brain that's called the cerebellum. And this is what a horse brain looks like, and this is the cerebellum. It's at the very back of the brain. It's Latin for little brain, and it is important for being able to perform everyday voluntary tasks with intent and purpose. So it makes a plan and provides proper muscle coordination and precision. Parts of the cerebellum are very important for balance, and as you'll remember, our horses don't seem to have difficulty with balance. They know they have the appropriate sensory information. What they have difficulty with is packaging all of that motor information and creating an accurately timed muscle coordination with just very specific motor movements. So there is a little bit of a map in the cerebellum, and the hind limbs kind of organized into one place and the forelimbs are organized into one place. So it might be that specific areas of the cerebellum are affected that are more in control of what the hind limbs are doing with specific movements. We can't really fully explain the abnormality being so pronounced when they back up. You did notice that mild abnormalities were present when they were walking forward when we looked at the motor recruitment patterns, even though we can't always see that there are abnormalities grossly when we're watching them walk. So in summary, what we know now from the research we've done in Shivers is that we are defining it as having to have difficulty walking backwards as our first defining criteria. It's not enough for them to just have difficulty picking up a hind limb. And the reason that they have that difficulty is because of excessive and simultaneous firing of both flexor and extensor muscles. And that specific stimuli incite that, like walking backward or asking them to pick up a hind limb. And those are kind of activities that aren't natural activities for horses. It's not like walk, trot, canter, and gallop that they would be born with. They have to learn to back up. They have to learn to give you that limb and to relax. So there's some extra voluntary part of that that's different from just a specific gait. And we think, with the limited number of animals we've looked at so far, that this abnormality may well arise from a specific region in part of the brain called the cerebellum. So tell me if you think this horse has shivers. What's different about this movement disorder compared to the ones that we've looked at so far? Well, one of the biggest differences that you see is with every stride moving forward, this horse has hyperflexion. So with Shivers horses that have Shivers Forward Hyperflexion, usually the first few strides or as you're turning, you'll see an abnormality, and then the abnormality will go away. In this case, it's present in almost every stride. And it tends to be worse on the left hind, but it is present in the right hind. So we would do a neurologic exam. We'd want to watch the horse turning. Does the turning make the horse work? Does the horse make any mistakes? Does it step on itself? Does it knock itself? Does it know where its limbs are as part of its neurologic evaluation? That's part of what the tight turns do. And it looks like it's fairly coordinated to me when it's doing its turning. So we're looking for evidence of sensory ataxia, which I'm not seeing as we're doing this exam. But we do have this motor abnormality where we will have the horse hyperflex from time to time, as you can see there. And this horse actually backs up quite well. It drags its feet a little bit moving backwards, but it's quite willing to back up. So this is an example of what would classically be called Stringhalt in horses, where we have pronounced hyperflexion that's occurring both at the walk and at the trot. And it may or it may not affect the horse's ability to back up. And in this case, it's affecting both hind limbs. So we would call this bilateral Stringhalt. So it may be present at the canter, but a lot of times it goes away at the canter, or you'll just get the odd abnormal gait at the canter. So with Stringhalt, you usually have a much more consistent degree of hyperflexion at the walk. It's usually present at the trot. It has a variability to affect the horse backing up. And the limb is usually kept underneath the body and pulled forward underneath the belly, whereas with Shivers, it's usually flexed straight up, and oftentimes with Shivers, the limb is held out to the side. It can just affect one leg. I put a bell boot on it so you could tell which leg is abnormal here. And this can arise for many different reasons. It's different from Shivers. So it can arise from trauma, particularly these cases that affect one side. They can fall and injure themselves. They can bang the leg, and they can develop Stringhalt in one limb following a traumatic event. There are peripheral nerve diseases. Thankfully, they're not very common in horses, but there are certain toxins that seem to affect horses that can also give you signs of Stringhalt. And many times, those diseases affect both sides. So just as a reminder, you always want to trot horses when you're looking for movement disorders, because the Shivers horse will trot normally and the Stringhalt horses will usually have this rapid, snappy forward gait at the trot as well. And sometimes horses with painful feet will show signs of Stringhalt. Sometimes Stringhalt is worse when it's cold. Sometimes it's worse on hard ground and better on soft ground. So there are sensations that can induce Stringhalt, and if it's all of a sudden a very sudden onset, you certainly want to look for evidence of pain in these horses. For example, a vet might do a nerve block and block out the sensation in the hind foot, and if that Stringhalt goes away, then it's an indication that there's something painful that's inducing the disorder. And this is the same horse on the soft ground, and you can see its gait is much improved on soft ground as well. So in certain areas of the country and in certain countries, there is a toxin that can be found in specific weeds that can cause a really severe form of Stringhalt bilaterally. Australia is particularly affected, and so this is sometimes called Australian Stringhalt, but it is seen in the United States on the West Coast, it's seen on the East Coast and the southern parts of the United States, and it usually is seen when we've had a period of drought and the pastures are quite poor, and the dandelions will grow, and the dandelions are the primary thing that's growing on the pastures, and some of the horses will start to eat them. And it's most common with this type of dandelion that's called a flatweed or flat dandelion. It's rarely reported, but can be reported with a common dandelion. And in Australia, it's been reported with mallowweed. And it can occur several weeks after you've taken the horses off of the pasture. So there's a bit of a delay. And it won't affect every single horse in the pasture. It doesn't tend to affect the youngest horses. It doesn't tend to be worse in the tallest horses on the pasture. And you can see here it can be really severe. And sometimes the hyperflexion is so high they almost bunny hop, or they will have their legs hyperflexed to the point where they are not quite able to get the other leg down in time. And their legs are usually pulled really quite far forward. And this particular horse couldn't back up at all. It would just hyperflex and not be able to back up. Usually if they take the horses off of the pastures, they're able to recover, but it can take up to 2 years for horses to recover fully. But in this horse's case, it was on the pasture for a long period of time without the owner being able to visit the horse and notice that it had the problem. And after a really long period of time, they can develop really severe muscle atrophy and nerve damage and not be able to recover. So if they are pasture associated, you'll usually find a lot of dandelions and not much else in the pasture. And there are drugs that veterinarians can use to try to decrease the amount of hyperflexion. And that usually is just going to nurse the horse through that period of time. And it's kind of a tincture of time to allow the nerves to heal for them to get better. For unilateral string halt, if it's trauma-induced, then usually you want to also try to do everything you can to get the swelling and the pain and the trauma under control. And then some cases, some veterinarians feel that they have some success sometimes cutting one of the tendons and a bit of the muscle that causes flexion of the hock. That can have variable effects. It's not universally effective, but sometimes it is an approach veterinarians take if they're really, really severe. But oftentimes it's a matter of whether or not over time you will see some improvement. Why do they have that really strange gait? Well, we think it's got to do with damage to nerves that are involved in something called a muscle spindle. So a muscle spindle is a sensor that's in your muscle that detects how much tension is in your muscle. And it helps you with knowing exactly how much muscle you need to use, for example, to stand straight and to work against gravity. In this example, when the cup is empty, you know exactly how much tension to hold the cup upright. If somebody fills that up, even if you're not looking, your muscles feel that stretch, and they automatically and reflexively contract because the spindle gets stretched and provide you with just the right amount of tone. And what we think is happening with string halt is these damages occurs to the muscle spindles. So rather than giving you a smooth reaction to the gravity forces, you get this very abnormal, snappy gait that you see with string halt. So the gait that you see with string halts is usually underneath the body and forward, and the Shivers Forward Hyperflexion is often held out to the side rather than up and forward. So the more that we've looked at videos that have been sent to us, the more we recognize that there are a lot of really strange movement disorders in horses. And some of them we just look at and go, oh, wow. And this is an example of that. It's not really Shivers. It's not really string halt. And as I said, we would rule out lameness and we would rule out neurologic disease. And then we would say, that is really weird. We have a lot more research that needs to be done to investigate the cause of many of these movement disorders in horses. And unfortunately, until we really understand fully what causes them, we're going to be limited in our abilities to know how to manage them. So to sum up, I think what we've done now is to define the types of movement disorders in horses as lamenesses or sensory ataxia or disorders of voluntary movement. We've defined the characteristics of Shivers versus string halt, where Shivers affects horses backing up. It's present occasionally at the walk for a stride or two as it progresses, but it's not present at the trot. Whereas string halt may or may not affect horses backing up, but it's usually consistently present at a walk or trot. We've talked about the factors that seem to predispose horses to Shivers: tall, geldings, often beginning by 5 years of age, and often slowly progressive, although in some cases, horses may have a rapid progression. We get histories of that sometimes in horses that have been purchased in Europe, where they've bedded fine, they've been through the stress of transport, they've been through the stress of standing still in a stall for a long period of time during quarantine, and then they can show signs of shivers when they've reached their new destination, which is very frustrating. And we think the reason that they develop shivers is because they've got this uncontrolled muscle contractions going on in their hind limbs, where they're all firing at once when the horses are asked to back up or pick up a limb. And so far from the horses that we've looked at, we've found abnormalities in the cerebellum, but as you can imagine, it's very difficult to get enough horses to look at a large number of cerebellums to confirm this. So we're still working on looking at cerebellums in horses with this disease. And our current research is focused on the question about whether or not there may be a genetic basis for this disease. It's certainly most common in certain breeds, like draft horses, like tall thoroughbreds, like warm bloods. We don't see it very often in shorter, smaller breeds of horses. So right now, what we are doing is collecting DNA. We can do that from about 1/4 to 1/2 inch of mane or tail hair, and then classifying the type of shivers, and we're storing that DNA so that when we have enough of it, we may be able to look at causes for shivers. So if you're interested in that, we have more information on shivers on our website, and we have submission forms where you can submit DNA and videos. If you want us to evaluate the videos of horses, we have to get the DNA samples so that we can combine those two things for our research. And then I want to acknowledge the United States Equestrian Foundation for giving us some of the initial funding to get this research going, as well as the College of Veterinary Medicine at the University of Minnesota and Mary Ann McPhail Dressage Chair Endowment. And all of you horse owners, again, just so many thanks for helping us with this research. There's no way with these rare diseases that we would be able to collect this amount of information without the terrific response that we got from our surveys and all of the information that you provided with us. And then also the veterinarians that helped us with this study. It was this Alex Draper's thesis, and Annabelle Armin, as I mentioned, did our neuropathology, our human counterparts in Dr. Konzak and Josh Amon, and then veterinarians that I've listed here that have all contributed to this research. And with that, I would be happy to see if I can answer any more questions. I don't think shivers makes horses more susceptible to other neurologic conditions. Sometimes there are other neurologic conditions that can mimic shivers, but I don't think because they have shivers, they're more susceptible to another neurologic disease. ISJ problems. Is that sacroiliac joint problems? It's certainly possible. Anything that makes horses more painful, and it does make shivers worse. So I do think that if they have other lameness conditions, we've certainly seen that, that will make the shivers condition worse if they're painful. I think they're much better to be out moving around. Now, every horse is individual, and certainly you have to take that into account, but being able to move about is really important. Some horses with really advanced shivers will have difficulty lying down in a stall, particularly if the stall is too small. So if they are outside, they might need 24 hours a day. They might need to have another horse that's going to stand sentinel over them so they're relaxed enough to be able to lie down. But sometimes as they get older, they'll have sleep disorders because they develop an inability to lie down. And yes, Australian Stringhalt has been seen in the United States. I'm not aware of whether or not it's been seen in the New England area. It's much more common in the southern parts of the United States and the western parts of the United States, but I don't know specifically which states have been affected. I don't know that shivers can lead to laminitis per se. There are many different things that can predispose horses to laminitis, but I don't think that, to my knowledge, shivers is one of those.
I think that's all the questions that we have.
Awesome. Well, thank you everybody for tuning in. And as I said, there are many weird and strange abnormalities in horses, and we certainly are working towards getting to the bottom of them.
Well, we'd like to thank Dr. Valberg for her presentation this evening. We really appreciate it. And we also thank all of you for attending the webinar this evening as well. You will receive a survey within the next couple of days. And if you could give us a little bit of feedback on this webcast, it would just help us as we plan additional webinars in the future. And also just a reminder that we will be putting this recording of this webinar up online on our YouTube channel. And I will send an email out to everyone who registered for this webinar with a link to that recording by the end of this week. So in the meantime, if you do have any questions, please feel free to contact us or give us suggestions at info@myhorseuniversity.com. And maybe we can stay on for a few more minutes in case we have any other questions. But other than that, we hope everyone has a great evening.
So another question was about Stringhalt with ivermectin. I'm not aware that there's been any association between those two things. There are a lot of horses that get Stringhalt. Are drafts as a whole affected? No, there is just certain horses within each draft breed that seem to be affected. So it's not one particular type of draft that I'm aware of.
All right, well, I think those are all the questions that we have. So once again, if you do have any additional questions, all right, and if you do have any others specific questions, feel free to just email us at info@myhorseuniversity.com and we will forward them on as needed. So thank you once again, and we hope everyone has a great evening.